Hello, my name's John Bowen. This talk is about making a trip to the veterinarian less stressful for cats. So the first thing to think about is where stress begins from the cat's perspective. We tend to think that this starts with the moment when the cat is being examined by the veterinarian. So they're on the examination table, the vet is beginning to examine the cat, and we think that this is the moment when cats start to show signs of stress. But in fact, the whole process of stress for cats during this trip begins with the basket when the cat is about to start the journey. And one of the reasons for this is because there's a fundamental difference between the way that cats respond to their environment compared with dogs. So dogs are primarily bonded to their owners, to the people that they're familiar with, and that means that when they make a trip to the vet, they're going with somebody that gives them a sense of security. So they're travelling with the people that give them a feeling of comfort, safety, and they're making the trip together. Cats, unfortunately, are bonded to their environment, and the moment they start to travel away from that environment, then they begin to experience stress. And they don't have the same bond with their owners, and they don't rely on them to the same extent, because cats don't rely on each other for social support when they're under stress or anxiety. So the problem is, therefore, that the moment that cats are taken out of their territory, they begin to experience some degree of tension and stress before anything else has happened to them. And the first thing that triggers this off is the process of trying to get them into the basket when they become aware that they're about to be removed from their territory. Fortunately, there's one aspect of the way that cats are bonded to their territory which enables us to some extent to trick them. So cats mark their home territory using facial and flank marking signals. So when they rub against things with their face and with their body, they're leaving little odour cues on those objects which remind them that this is somewhere that feels safe to them. So this scent gives them a sense of security when they're in their home environment, and we can use this to trick them into accepting the process of going on a trip to the vet. So how can we minimise stress? The first thing that we would do is take the cat's scent and try to transfer it into the travel basket. So if we've got a particular bed that the cat uses regularly, we might put a blanket onto that bed and allow a few days for the cat to get used to using that bed with the blanket to transfer some of its body odour onto the blanket. And then we would use that blanket transferred into the travel basket to carry some of that cat's odour into the travel basket. Now, ideally, what we want to do is leave that travel basket around for a few days for the cat to get used to it before the journey. Obviously, in some cases, we're not able to do that because it may be an emergency. We have to take the cat to the vet because it's ill. But if this is for a planned situation, like going for a regular annual checkup or for vaccination, then we should try to plan a few days ahead and give the cat plenty of time to get used to using the basket. And ideally, we would like to have the basket left accessible to the cat at all times, somewhere in the house, preferably close to somewhere that the cat would usually go to lie down and rest. So what we want to do is see that the cat is going into the basket, exploring. Maybe we could leave some treats in there or a toy to entice the cat to come into the basket, and hopefully by the time that we get to the point of travelling to the vet, the cat's already fully acclimatised to going in and out of the basket. And ideally what we want to do is transfer the cat into the basket and cover it before we start the journey. So we would allow the cat to explore the basket, try to encourage them to go into it, shut the door, put a cover over, and then while the cat is settling in the basket, we go to prepare the car ready for the journey. So that gives the cat a few minutes to get settled into that environment. Now, during the journey, it's very important to keep the basket covered so that from the cat's point of view, from the moment it leaves the house, it doesn't see any unusual things going on. It doesn't see dogs or passers-by, strangers, traffic. We want to minimise the number of stressful things that the cat sees. And once it's in the car, we want to wedge that basket into a position where it won't move around during the journey and in the safest and most stable location. And generally, that's behind the passenger seat, wedged in so that the basket doesn't move around at all during the journey. And this isn't a comment on people's driving, but we need to be very careful to drive smoothly, not brake suddenly, not make sudden movements in the car or accelerate, so that we minimise the amount of movement and stress that the cat will experience. And think about the cat while you're travelling. Keep the windows closed so there is less noise coming in from outside. Don't play loud music. Don't go on the phone and make noise, because all of these things are going to increase stress for the cat. What we want the cat to experience is being enclosed in a familiar smelling space with the minimum amount of external stimuli that are going to make the cat stressed. When we get to the veterinarian, some veterinarians have cat waiting areas, and these are better if you can use them because they're an area where the cat isn't going to experience any dogs or other animals that it might be frightened of, and usually those places are set aside so that the cat can't smell dogs or see them or see too much activity. Maybe even there is a separate room. In this clinic there's a cat waiting area, and we should go to that or find a place in the vet clinic where we could sit away from the other animals, maybe even ask if there's a possibility of sitting in one of the clinic rooms while you're waiting so your cat isn't disturbed by seeing other animals. And it's very important to try to stop them from seeing other animals, particularly cats. So cats intimidate each other by staring at each other. And you can imagine that if two cats are in their baskets facing each other across the waiting room, that's extremely stressful. They're giving threats to each other in the same way that we would think somebody staring at us is very threatening. So you'd want to keep the basket covered, or if it isn't covered, have the basket facing you and not facing into the room. Ideally have some kind of barrier so that it's not possible for the cat to see other animals. We know that cats' visual system is adapted to lower light conditions. So cats are generally more active at dawn and dusk and overnight, and their vision is set up to deal with low lighting conditions. In bright light it can be quite uncomfortable for them and quite stressful. So in a lot of clinics you'll find that staff corridors are brightly lit for us to use, and that clinical corridors that go between different parts of the clinic will be much darker, and that's to help the cat, if there isn't a cover on the basket, to feel more safe. Ideally we've got the basket still covered, so it doesn't really matter for us, but just to point out that that's why we often see different lighting levels. Once you get into the clinic room, again, very often clinical rooms are very brightly lit to make it easier for us to do the examinations. But the problem is, again, for cats, this is too bright. It's difficult for them to feel comfortable in that environment. And particularly if they've travelled in a box which is covered, when they go into the clinic room, we remove the cover. Immediately it's very brightly lit and it takes some time for them to adapt to it. So generally, we try to turn off all of the main lights and use something like a spot lamp to illuminate the ceiling to reduce the light levels generally. So if your vet does that, that's why they're doing it. It's to try to make your cat feel more comfortable and to reduce the light levels. And initially we want to keep the basket at least partially covered, but with the door open, so the cat can then gradually acclimatise to the different environment, the smells, different illumination levels, and hopefully then there's a possibility the cat may come out spontaneously on its own. But we do still need to minimise noise and disturbance levels. So it's important to have signs on doors to say no entry or to discourage people from coming in. And if you're travelling there with family, everybody should go into the room together. Don't allow people to come in halfway through the consultation because they've been making a phone call or they're parking the car. Everybody needs to go in together and allow the cat to fully settle. Hopefully the cat will then start to come out on its own. But even if it doesn't, we want to wait for several minutes to allow the cat's adrenaline levels and stress levels to come down before we go ahead with any kind of examination. Now, in some cases, we're even going to have cats that are admitted to wards. So they're going to undergo a physical examination. The vet is maybe going to decide that the cat needs to be admitted for blood tests or whatever it happens to be. And so that's the next thing that we need to consider. So cats are going to be admitted to a ward, and the first thing we want to do is return the cat to that basket, cover it up and allow the cat a little bit of time to settle down again before we move the cat into the basket, into the wards. You'll probably see signs on doors into wards which will say things like keep noise and traffic to a minimum. They're trying to discourage people from walking into the wards while they're moving cats around. You'll see often handling information on the ward doors that will explain how to handle stressed cats, and those are very good indicators that the clinic is trying to do its very best to make sure that your cat is as non-stressed as possible. When you get into the ward, you're probably going to find the same kind of things as you did in the clinic room. The lights are going to be dimmed. Some of the cages are going to be covered, and the reason why we have these towels on the fronts of cages is to enable cats to feel safe, so they're not watching people moving around, they can't see other cats being handled, and it minimises the amount of tension that they experience from seeing what's going on around them. One of the things that people often forget about is the journey home. So obviously we need to adopt the same approach as when we brought the cat to the clinic, so we need a nice, quiet, calm journey, keeping the basket covered. But the most important thing is when we get home. So often people are very keen for their cats to be reunited with the other cats, or reunited with family members or other pets in the household. But actually this cat's just undergone a very stressful experience, and the most important thing is to put the basket into a room where the cat feels comfortable, open the door and allow the cat to come out spontaneously, keeping it away from other pets for at least 30 to 40 minutes. So giving the cat plenty of time to settle down back home, and particularly we want the cats to groom themselves. This may not seem like a very important thing, but because cats identify each other by scent, if a cat comes home with an unusual scent on it from handling or from some of the things that have been happening to it, other cats may find that very upsetting. So if there are other cats in the household, they may react in a quite hostile way when a cat that's been to the veterinarian comes home. So if we allow the cat plenty of time to settle, to groom itself, it can then remove some of those unfamiliar odours that other cats might react against, and it means that that reintroduction is not going to go wrong. So to conclude, probably the most important thing that we do with cats is take them to the veterinarian, but unfortunately they don't like travel. So as long as we follow some kind of basic rules about how we get them into the basket, how we acclimatise them in the clinic, and how we reintroduce them when they get home, we can actually make this whole process less stressful for them. So thanks for your attention.